So they are working closely with their civic leaders, they're working closely with hospitals, with nonprofits to ensure that no one is left behind in this illness. And this is a daunting
Dr. Amy's back on, y'all.
right now. It's very hard for us to say much because we're only testing, again, the sickest and highest risk individuals. One of the things we are working on is this.
Y'all want to see Dr. Amy?
We've been able to do widespread testing of the population, the mildly ill, the asymptomatic. And it's crucial that we do that in a way that gives us a very good picture across all.
Our one person is there.
Not only by race and ethnicity, we have to take special attention for those who are disabled, for the elderly, for folks that are dealing with life-threatening illnesses. There are a wide variety of ways that we need to ensure as we respond to coronavirus that we leave no one behind. So this is something I take very seriously. I always have. We've dealt with these disparities and differences in life expectancies and outcome on a number of issues, infant mortality and maternal mortality, just to name a couple. So we really want to take this seriously as we try to give out resources in a pandemic. And I will continue to share with you what we know as we know it. These are important numbers for us to follow. I also want to say that another group that we have to think about are the folks in congregate settings. As the governor shared, we had a tremendous discussion in response to outbreaks in our prisons and in a federal prison this weekend. Those on the front line have been doing an outstanding job. We convened a call. It was really one of our first tests of our zone approach. We have hospitals responding on the front line, Salem Regional, East Liverpool, Trumbull, Mercy, and those folks have performed admirably. I had the privilege of listening to the docs on the front line.
You stay right there.
And we know that we are sending out our Ohio Guard to help in our response. But one of the new ways we learned from and did an excellent job is we brought in our regionals. So we brought in SUMA, Mercy, Cleveland Clinic, Trinity, and all of those are working collectively to make sure that we balance patients so that no one hospital is overwhelmed when there is an outbreak in any setting in Ohio. And so that is fantastic. That's exactly what we want to see to make sure that we're balancing the stress on our healthcare system. So very, very proud and optimistic about how we are responding. And once again, here at the state, our job is to help come alongside partners as they face these outbreaks and bring really the full strength of the governor's office in the state to bear to help alongside of you. So very, very proud to those in the prison, to all of those affected by this. You know, our heart goes out to you. We are thinking about you, and we will do everything to give you the very best care that we have. Thank you.
Dr. Ashton, thank you very much. Who has questions?
Hello, everyone. William with ABC 6 News. I have a question if you could expand a little bit more on the sites that you've designated for the surge of patients. Can you talk about the number of beds you're expecting to put in each one of these? Are these for COVID-19 patients, and will the National Guard be there as well?
Well, I'm going to refer this to Dr. Acton. I don't have the exact numbers. I'm not even sure that the exact numbers are available. The first job was to find the location. And basically what we're talking about is not standing up a new location. Preferable, and you saw this in the places that I named, there's a big locations that have the opportunity to hold a number of people. They can build them out, what you have seen on TV in other locations. It will look similar to that, I suspect, but it's the ability to add additional beds, add additional capacity. Dr. Andrea?
Yes. I just want to add, as I promised on Saturday, we have been working nonstop on the zone and regional plan. You've seen some preliminary information, but the governor and I will be presenting a much more elaborate description of it by midweek. I hesitate to say because, again, we are standing up an unprecedented response. And I think it's important to give the viewers all the information together. Some general principles again. We've known that we need to about double our hospital capacity for a surge. The exciting news, and again, this is information that is not finalized yet, but I'll try to give you a little hint on this, is that our social distancing has absolutely had an impact. So I think we're going to be sharing some promising numbers. We are still going to have a surge, and I can tell you this is going to be a hard week, and we have a couple hard weeks ahead. So I want people to be optimistic in the sense of we can't let up. The moves we're making are taking so much pressure off our hospital system. We are going to have a complete package of slides and graphs and information for you this week.
Yeah, it take a little longer. Gotta go pee, gotta
Right ahead of that surge, we're
wipe,
gonna give you everything you need to know.
wash hands for
But we're making a
decades.
difference, but we cannot let up. The second we let up, it unravels, and we will need tremendously more hospital capacity. So we are going to show you how that is being stood up. The build-outs that are occurring, some have been announced. We've heard of work going on in some of our convention centers. But I want you to know that the highest acuity patients are staying in hospital settings or in pre-existing settings. They're not going to be out intense. We're fortunate because of the time we bought, we're able to use brick and mortar. We're able to build in a very thoughtful, intentional
We
way.
like Amy.
We're so blessed in Ohio by this.
She's down to earth. I need to Google her. Amy Acton.
That will be for people that are stepping down out of the hospital, lower acuity folks. So
She
that's how we'll
cold.
be using some larger structures. I know you've
Like her and
the Duke Stadium, the convention centers, that sort of thing. So
Dr.
when we
Fauci.
give you all that information, that's one thing.
That's where I get my info from. Her and Dr.
Just
Fauci.
like in the outbreak we had in Columbiana, all our systems work as normal. You still go to your same doctor, same healthcare provider, or if you don't have one, and you don't go to a federally qualified health center, you would go to your local emergency room, calling ahead first. You still go to all your same hospitals and do all the same things. For those of us at home, all the same activities. So if you're sick now, do exactly what you would normally do. Let your provider know and work with them. But then the rest of this, making sure that we spread you, that the ambulance goes to the right hospital, that's all up to the hospitals behind the scenes. We have a regional system that does that. We actually do that every day for traumas when they occur, or big accidents, or maybe a tornado. So those systems are in place, but they're being ramped up extensively, and we saw it work very well to be able to come alongside that first local hospital in Salem. So we'll give you lots more. Sorry, it's not today, but I'm going to give it to you complete. Thank you.
Kevin, my name is WBNS 10 TV. My question also is for Dr. Acton. Hello, how are you? Today, the Institute of Mental Health Statistics out of the University of Washington put out new modeling today, and it's being shared a lot on social media, so I wanted to bring it to your attention. It says that we're 2 days away from the peak, that we have enough beds and ICU beds and ventilators, and we're 6 days away from the peak of deaths. Do you support this model, and what can you tell us about this hopeful outlook that this modeling is presenting? Thank you.
Well, I will be going over the modeling extensively this week with folks. We'll actually show you a bunch of new graphics on this, but once again, we're finalizing it. So it is the Institute of Health Metrics that you might have said mental health. So it's easy, and that model has been discussed in detail. We've worked with them closely as well. But I'll be giving you a lot of detail about how our statistics are actually based on the facts of our cases and our states versus the statistical modeling that's based on deaths. And as we know in Ohio, especially because of our limited testing, especially because we've done so well with social distancing, our data is on deaths is far behind that. So we know that we are making a dent in the hospital surge. So I think we'll be able to celebrate some things, that it is not the worst case scenario that had been raised in some of the early Cleveland Clinic data modeling. But I think it will not be as optimistic as as that data. It will be somewhere in between. And really the issue for us is the stacking of patients. I'll be talking more about that this week, and I'll break it all down for everyone so it's a lot easier to understand. But it is about how long people stay in the hospital. So I feel, and I'm excited about sharing with you this week the data that we're using. I feel that the modeling is staying right. It's actually, we go back and see if it predicted what we experienced, and we're spot on. So I think we're going to have some great numbers that are the most accurate for Ohio to share. Again, probably midweek, as soon as I can get them to you.
Thank you.
Hi, this is Molly Martinez with Spectrum News. My question is for the governor. We've gotten a lot of viewer feedback from essential workers that say that they don't feel safe at their work, and specifically letter carriers. They say they go into the post office in the morning, none of the mail is sorted, and they're all sort of cramped in there. They don't have any PPE. They're touching all of our mail, and they're going from house to house to house. Is there any plan, I know that's a federal job, but is there any plan to keep them safe?
Well, that's a very good question. It's something I will take up with the post office. I've not myself received any specific complaints, but that doesn't really mean anything. I get anecdotal reports from around, and of course, the average citizen is not in the back room where they're sorting the mail, or where that is taking place. So I certainly will check into that, and I'll see if we can get some improvement in regard to that.
Thank you so much.
Jim Robbins with the Toledo Blade, and this question is for Dr. Acton, I think first, and then possibly the governor. That because Michigan is going to peak a week or so before we are, that the beds in Northwest Ohio could be taken up by people from Michigan, and that they won't be available when our surge comes. Could you respond to that and tell us whether a doubling of capacity is going to be enough?
Absolutely. I'll bring you more details on that because I haven't, in the last couple of days, spoken with them. But it is something we're taking into account in all our building. We know that we share borders, workers, and hospital systems, containment areas across states. It's true even in Columbiana, in the prison I was talking about. Often care is received over in Pittsburgh, right across the border where I grew up. It's a little closer even than, say, going to Akron. Similarly, we have that across the border in Toledo area, and we have that in Kentucky. And all of our zones, our CEOs who are taking a look at that, have actually been working closely across the borders to assure that that capacity is there. So they're taking across the borders into account. And I'll give you some more details on that when we roll out that zone plan.
And do we fully expect people from out of state to be in our hospitals in Ohio?
I think some do seek their regular care there. So I think there will be some of that. I know I've spoken with the health commissioner in Michigan, and they have a similar triage plan that they're looking in their state. So they're aware of this. They're aware, that we're going to spike not long after them. We're fortunate to be behind them a bit, but those are all things that we're having conversations about and taking into consideration.
Thank you.
Hi, this is Jeremy Pelzer with Cleveland.com. Hi, this question is for Dr. Acton and Governor DeWine. Following up on the question about modeling, last Friday, the CEO of the Cleveland Clinic said on MSNBC that the clinic's modeling shows that coronavirus will peak in Ohio between mid-May and mid-June as a best-case scenario. Now, this is later what you and the governor have been saying, citing, among others, of course, as you said, the Cleveland Clinic. So why is there this discrepancy? And do you believe this is going to last into summer? And, what is this why you and the governor decided to close swimming pools and other summer-related activities? Thank you.
Thank you. So the battle of models continues, and there's a lot said about this, but I am promising you all, the governor will give me a good chunk of time, about midweek. I'm going to do Modeling 101 for everyone and sort of help us all get to the bottom of this. But I feel that in my estimates, the peak will be late this month to that May 5th time. But that all, the Cleveland Clinic's modeling took into account a different peak on the social distancing. People at home, you are moving mountains. You are saving lives. Again, I get emotional talking about this because this is no small thing that we are doing together. It is so incredibly hard to have shut down our lives the way we have. I am absolutely certain you will look back and know that you helped save each other in this state. That the impact is profound, more than I'd even hoped for was possible. We've never been here before. We've never fully executed these kinds of strategies on a scale that we're doing in modern society, and it's working. So I feel very comfortable that the data I'll share with you this week will show that, but please at home, don't stop. We are picking these dates like May, and we're letting you know that we know we have to slowly come out of this. But if we do it right and we keep doing it right, we can get out of this a lot sooner and a lot healthier and get ourselves back to our lives a lot sooner. So thank you.
Let me just kind of state the obvious. In each modeling, no matter who's doing the modeling, there are assumptions. And one of the biggest variables is where social distancing is on that date and then into the future. So the biggest variable is what is the social distancing. So if you build in and you assume we continue to do what we do, you end up with one result. And I'm not saying that's the difference between the different models, and Dr. Acton will go into much more detail there. But, we're kind of like I love baseball, so I'll make the baseball analogy. Everything I make the baseball analogy to. It's like a baseball
My
game.
people back, Max.
162 game season, and you're winning, but then the next day you start all over again. The next day you start all over again. And so this depends on what
Here,
you do every
this-
day. We're on
Need to
straight, we've
watch
done
this
well, but we
today.
have to just keep repeating
Didn't even blow
it.
dry,
And
and
if
it's
we
just
don't do it, all that modeling goes out the window and fundamentally change what
My dog.
what is going on.
my dog.
Thank you.
Good afternoon, Laura Bischoff, the Daily News. I guess my question is for Governor DeWine. I've heard a lot from people who have loved ones in the state prison systems, and they're very worried about the coronavirus. And obviously, you're going to give us more information tomorrow and maybe even later today. But what assurances can you offer to inmates and their families during this crisis on, steps you're taking to prevent? Right.
First of all,
This should be a testament for nobody to commit no crime.
Everyone who has a loved one in prison, everyone in prison,
6 feet.
that we will do everything that we can every single day. Our director.
They can't just let everybody out the joint. This is the bullshit that I mean. What the fuck do they think?
She's been preparing for this. She's been doing the testing.
The motherfuckers on the Navy ships, on the boats. What the fuck we doing? You know what I'm saying?
The testing didn't just start yesterday.
I'm not knocking the folks in the joints, but goddamn.
She has been checking the temperature of guards when they come in. And
Y'all keep checking people's temperatures and asymptomatic. How do y'all not figure out this asymptomatic thing?
And what has happened is in most of the prisons, it's been
Asymptomatic. I'm gonna do TikTok while we do TikTok with the TikTok.
Is like every other group, small group of people.
TikTok. Max, you're gonna do a TikTok while we on here.
And so this is something that we're going to have to continue to battle. But the director's doing a lot of different things. She is doing everything she can.
TikTok. Ready for
reduce
TikTok?
the
Right?
contact
Max. Come on, see us do
among
TikTok.
prison to
Y'all can be in our
prisoner
TikTok.
to prisoner, but also
Okay.
anybody
Watch
that
TikTok,
is
TikTok.
coming into that prison. And
YouTube person that's watching this video, make sure you wave or do a thumbs up on a like or something. TikTok.
To make it less contact.
TikTok.
And to do everything we can.
Hey, TikTok. Guess what? Hey man, how these people keep going on talking about they're taking temperatures and everything else when you got folks that's asymptomatic that are walking around that don't know they got shit.
On different conditions.
They don't know they got nothing. But y'all want to take the temperature, have them go to work. Non-essential construction. Non-essential. Let these people be at home, flatten the curve. Flatten the curve. Guess what? Flatten the curve. That's Mayor Mike DeWine in the background right there.
We have tried to
Talk about the prisons. Okay, we got people on boats. We got Navy people stuck on boats. We got people stuck on cruise ships. Asymptomatic. She get it done. Hey man, flatten the curve. Stay home.
That judge wants to place on that individual.
You like that TikTok? TikTok. TikTok.
They're taking temperatures and everything else. Man, you got folks that's asymptomatic. But we want to tee this up for them and basically say these are some potential ones. But y'all take temperature and and the vast majority of the cases tomorrow, with a few exceptions, I don't have the ability to move quickly. Again, we set them up, we send them back to the judge, we send a letter to the judge, and then the judge is the one who can, in fact, move quickly.
Flatten the curve.
Whatever criteria, if the judge decides to release them, then set whatever is the proper criteria. So another thing that is happening in our prisons is that the number of prisoners coming in every week has gone down. That in and of itself is starting to take our population down.
Non-essential
that is going to
construction.
So we're picking up significant numbers. And the whole idea, for those of you watching at home, the whole idea is a couple of things. One is to give
Is
prison
new
officials more
construction
flexibility to be able to
building
move people around,
essential
put them
or
in a
non-essential?
more secure setting, a better setting, to reduce the chances of someone getting the COVID virus. And so that all of that goes into the mix, and that's what we're thinking about. We'll have more tomorrow.
You don't have the ability to, act quickly on this. You can't use your power to communicate.
This is it. I got a constitutional lesson in this, and this goes back a number of years. The Constitution was changed, the criteria.
But
certain
y'all want to
things
take the
have to
temperature,
happen.
have them go to work.
Mhm.
For example, the parole board has to take a look at. You have to have notifications.
Flatten the curve.
It is a process that generally takes at least 60 days.
Flatten the curve.
So ultimately, I can make that decision.
Mayor
But I
Mike
can't
DeWine
make
in the
that
background
decision
right there.
right now. That pushes out. There's a couple
Talk about the prisons.
cases, if the case is already 2 million
Okay, we got
gone through
people
all
on
that
boats. We
procedure,
got-
then I can make a decision. I'll have some of those tomorrow. But in the majority of these cases, it's a 60-day waiting period. That's if everything goes right. So obviously, we'll have 60 days.
OBJ.
Our concern is the safety of the drivers, safety of all prisoners, and the safety of the public. So we're balancing all of those things, trying to make these decisions.
You all addicted.
This is Jesse Ballmer with the Center. I've got a question about convention centers, so really either of you. At what point should Ohioans expect to see patients at convention centers? Like, are there certain circumstances that would trigger that? And then would it be COVID-19 patients or other types of patients?
Hi, Jesse. And everybody's wearing, you can't see this at home, but everybody is wearing a mask. So with each person who steps up, it's interesting to see.
Some of the real
Yeah,
Hey,
they're pretty elaborate.
Hey man, how these people keep going on talking
So the convention
See what I'm
center will
saying?
be a later stage use. We still have, thanks to all the steps we've taken and the policy moves, capacity, good capacity in our hospitals, which is exactly what we wanted. Hospitals have built out their capacity on site. They're using different parts of their hospitals differently. So I would anticipate that it would, even though we're gonna start work on convention centers, because we know that will take time, we are a ways away from needing to use them. Again, we're gonna go on the cautious side as we do with everything we do in Ohio and prepare for the worst and work our way back. And again, I anticipate that we would be seeing more mildly ill convalescing, potentially isolating or quarantining people. You know, our sickest folks will be probably more in a traditional bricks and mortar, and that's sort of a strategy we've adopted as a state because we've had the luxury to be able to do it that way. Thank you.
What's up, dude? Come on, man, I'm trying to do my TikTok.
Peter Robbins, NBC4. My question's for Dr. Acton. This week, the Surgeon General said that this week for America would be the hardest and the saddest of most American lives. Do you feel that urgency here in Ohio, and do you think that this week could be our tough week?
Well, I have to tell you, he's speaking truth. I feel it. I feel such a tremendous sense of urgency, and it's something I can hardly put words to. You know, we are going to see in places like New York, Louisiana, we're seeing it in Detroit, in Chicago. It's going to other places. Indiana is getting hit hard right now. They're ahead of us a bit. But I think for all of us, anyone who's watching the news, you're going to see the devastation of what is this terrible, terrible disease we're fighting. And we're seeing it here in Ohio. We're not seeing it as much, but I'm struggling and hearing the stories. I was listening to the doctors and the folks talking about what they're going through. So I think
Who the fuck?
more and more stories. I don't think this is our peak.
Hello.
I think our
Shit,
peak
what's
is
going on?
further out. I think everything that we are doing is to lessen that impact, to lessen those kinds of scenes that we see here, to really be able to control our surge and control that response. That is everything the governor and lieutenant governor have been fighting for. And again, at home, don't give up. Our ability to control this storm and this threat is in our hands. Everything, we're doing all the healthcare things we can do. We are building that out. We are doing all the moving of mountains. But a huge part of it is what we're doing collectively. So when we see some of the things that are hurting us so much to see, and there's plenty of Ohioans here who, you know, there are how many deaths today? 142. That's everyone in their sphere, and their lives, and their friends.
I mean, getting them on walk. I mean, somebody, I noticed one bitch that got some of this shit. I just talked to her last night. Shit, she got I think she had like 250 of them already made.
Impact us, and as we see this,
I gotta find out. That's what I'm saying.
Double down on your commitment in Ohio. Double down. And I'm a competitive person. If that's what it takes, if it's a baseball game.
Damn, you messed up my little video.
And let's fight this together. We do not want to be passive and let this virus own us. We have got to own everything that's in our control.
Thank you.
Hello, it's Andrew Walsh-Huggins with the Associated Press. Once again, thank you for taking our questions, and I guess today I am the last question. This is for Dr. Acton. We're getting, obviously, piecemeal reports about how things are going in nursing homes and skilled nursing facilities. I think just because of the way we're divided.
Oh yeah, we got mass.
Give an overview of how things are going in facility by facility. Is it good, bad? What are your concerns?
Well, everyone knows during this pandemic, and we saw it very early on in Washington State, that any time we have what's called a congregate setting, when people, whether it is a prison or a nursing home or other institutions, that is a place where we can be particularly vulnerable. I have to say, folks in our teams, we've doubled down. We have strike teams whose only focus, whenever we hear of even one case in a nursing home, that local health department is surrounding that, doing the contact tracing. And then they work with us at the state, and we have a whole team of experts. We get on the phone, literally, with every one of these hot spots. We'll call them hot spots moving on. I've been calling them spinning plates because we'll have more and more of them as the days go on, and we go uphill here. But we come alongside with the best epidemiologists, our best medical providers, and we work on solving that alongside the locals. All of this happens at the local level, but we work alongside of you. So we are seeing that, you know, I know in Cuyahoga, they can tell you a lot better about the names of the institutions, but they have, you know, more than 20 institutions that have cases in them now. And that's to be expected in this epidemic. It's to be expected. We will be sharing with you some guidelines we've created as a state. It's really important. Something we're learning from this pandemic is that the more we can be consistent and have guidelines that we all share, the better. So we are actually, Maureen Corcoran, who's our director of Medicaid, has been working very closely with the team, along with Director Ursel McElroy, who you know from Aging. And they've been working tirelessly on sort of best practice standards. They've been sharing that across the industry all along, but we'll try to share some more of that with the public so they can have an understanding. But then we're taking what we've been doing all along, what are best practices, say in a prison, our director of prisons, one of the best renowned health experts in prisons, who's helping many other states, by the way. We take those best standards and we make sure we're implementing them across the state. And then those are being wrapped up into our hospital zone plans, because all of these folks ultimately may need that hospital system and might need to be discharged back to where they came from. So all of that is being coordinated together, and that's sort of how we're approaching it as a state, using the best guidance we can find.
Thank you.
Thank you.
Well, we'll close with a video that we've made for our hashtag Stay at Home Ohio. And this features students from Gahanna Lincoln High School, Marion L. Steele High School, and Olentangy Orange High School.
Hello? Can you hear me? What's up?
Oh, nothing. I just saw your message. And I thought I sent you an email or a text earlier this morning, but I never hit send. Because do you know, so she had some kind of revelation over the course of last night, and she's revamping them now. She feels like they're too big.